All right, well, welcome back. Time now is 7:40, and February is Go Red for Women Month, a time to raise awareness about heart disease, the #1 killer of women. Joining us this morning are local survivors Christy Sidler and local survivor 2026 Go Red for Women chairperson Reese Mason, sharing their powerful stories and why wearing red can really help save a life. First of all, thank you so much for joining us on Good Morning Jacksonville.
Thank you.
Well, I had a good time at the luncheon last year. I got a chance to host with you all, but this is bigger than a luncheon and bigger than any event that's happening. Christy, tell me exactly how you feel when you're going into the month of February.
It's such an important event, experience, momentum. We, as women, tend to think that other diseases like cancers or things that we may not think are affecting us, and heart disease oftentimes is thought of as a men's disease. Women tend to take care of others more than they take care of themselves, and so we just need to be reminded. I know when I was first diagnosed, I was actually misdiagnosed, but I was told you didn't eat enough. It must be your period. You are dehydrated. There are a lot of reasons to dismiss what is happening to women. We need to be able to know that we've got to take care of ourselves so we can take care of the others that we love.
Yeah. Reese, take me back to that time where it happened. What were you thinking? What were you going through?
Yeah, it's actually, our family has been diagnosed with a rare gene disorder called MYH7. So when my son Austin was just 4 months old, he had a heart transplant. And there was no family history at that point. So it was very much a mystery in terms of where this originated. Since then, I have a younger brother that went into heart failure. That was just a few years ago. And so 2 years ago, they asked me to go through the testing again. I did a stress test, much like Christy, and blew it out of the water, but we found out that my ejection fraction was extremely low, and they started me on the whole regimen of medication. Dilated cardiomyopathy is the diagnosis. So it's been a shock. I've known it's in our family for the last 10 years and going through it with Austin, but having experienced it now with multiple family members has really been a shocking experience, but we've learned a lot through the process.
Right. But Christy and Reese, you look amazing. I'm sure at that time you felt good. What was it that you knew? Well, for you, it was in your history, but for people at home who are like, I'm fine, I work out, I'm good, but you're taking care of laundry, you're taking care of the kids, the husband, you're doing everything, it's on your shoulders. And oftentimes you really don't know how stressed you are until your body actually tells you.
Yeah, and it's interesting you say that. I think I was extremely fit. I was teaching a fitness class and I passed out in front of my students. When I finally was properly diagnosed, I was training for a triathlon, and my heart rate went to 280 beats a minute, and I was by myself. So I was not the poster child for heart disease. And I think we as women, if your mother or your sister or your best friend said, gosh, something's not right, I don't feel right, what would we do? We would say, you have to go get it checked out. Mm-hmm. But when it's ourselves, we're like, I got the laundry to do. Yeah. I got my kids to get to. So we have to listen to our bodies, and no doctor is going to turn you away for going in and saying something's wrong. Even if it's not, we're much better off to try and take care of ourselves.
And I think to that point, one thing to note is that in women over 20, 45% are living with a cardiovascular condition. Wow. So when you think about those numbers, go learn, what is your blood pressure? What's your cholesterol? Having that information so that you can at least have a baseline, and when you go back, you'll know if something's improving or getting worse, and that is critical to early intervention.
All right, so you have been a part of the American Heart Association. You're rocking your red. I know next week on Friday, it's going to be our Go Red for Women Day. We got about 30 seconds left. How can we tell folks to join and be a part if they don't know anyone who's going through this?
Well, one is to wear red on that day. Our communities and our landmarks are going to be going red in celebration and awareness of women's heart health. You can also post at #FirstCoastGoRed and Wear Red Day, and we would encourage you to do that in support of the women in your community.
And watch the city go red too. I know last year Daly's Place was red. Our studio will be red for you all that day too as well. So just encourage people to rock the red. I know you guys saw me in purple earlier this morning. I put my red on, so it's as easy as that. Just make sure you have something on hand on Friday. So ladies, thank you so much, and you look amazing.
Thank you
so much for inspiring women and men too as well,
Yes.
to go out and know their numbers. All right, we'll be right back with
you.
more. You're welcome.